Welcome, everyone, to my capstone presentation. My name is Whitney Reeve, and the project I am proposing is a continuing education workshop entitled Walk With Me, Building Therapeutic Relationships Between Generalist Practitioners and Cancer Survivors. Before we dive in, I'd like to clarify that the generalist practitioners I am referring to are mental health care providers, such as social workers and psychologists who do not already specialize in the field of oncology. I am also using the term cancer survivors to include anyone who has had cancer in their lifetime, whether they have been recently diagnosed, are in treatment, remission, or survivorship, or are not expected to live through their cancer. I'd like to begin with identifying the underlying need for this intervention, which is that generalist social workers and psychologists need psychosocial oncological skills in order to provide therapy that is comprehensive, knowledgeable, and inclusive to cancer survivors, ensuring equitable access to treatment. The reason why fulfilling this need is so important to me is that my mother has stage 4 ovarian cancer, and she has lovingly and bravely allowed me to include her pictures on my poster. When she was first diagnosed, she received treatment at a cancer center in Arizona that did not have psychosocial oncology as a provided service. My mother was told that there was only one clinical mental health care provider outside of the cancer center that she could be referred to. And unfortunately, my mom and this therapist, who did specialize in working with cancer survivors, did not connect. She tried a few other generalist therapists with no luck before fortunately stumbling upon a therapist who was a cancer survivor herself. This last therapist came after several months of treatment, during which my mom was experiencing crippling anxiety and depression. And my mom admits that if it had not been for my help, she would have given up the search entirely. My mom has since moved up to Washington with me, and her new cancer center is a night and day difference. It is also, coincidentally, where I'm completing my practicum. Multicare Regional Cancer Center has a collaborative care model and incorporates 2 clinical oncology social workers as part of a comprehensive care team. A vast improvement, but both oncology social workers admit there is a need for additional support for cancer survivors in the community. To quote, "We're looking at referring to general practitioners who are good, who know how to manage depression or anxiety, but don't understand the specifics of cancer. We need multiple clinicians in the community that specialize in cancer available to take our patients." And they recognize that there are only 2 of them, and their interventions are not intended for long-term support, especially once a cancer survivor has completed treatment. One admits, "It's crazy to me how difficult it is to get a patient access to mental health services. I'm very thankful that we can be that for a lot of people, but there are also a lot of people that need more than even we can provide." This is why the goal of my project is for cancer survivors to have increased comprehensive, accessible, and available mental health care, that they are empowered through choices of a more educated, ready to serve, and diversified field of mental health providers. The problem my mom is facing is not unique to her, nor is her struggle. Research shows that many cancer survivors face mental health challenges to some degree, whether it is depression, anxiety, distress, somatization, or some combination thereof. This can adversely affect treatment compliance, prolong stays in hospitals, hinder one's ability to care for oneself, and have a negative effect on personal relationships. More importantly, research demonstrates that there can be a harmful influence on the clinical course and prognosis of the cancer, and ultimately the quality of life is diminished. But there is hope. To paraphrase Nikolai Chuk et al., a non-judgmental, holistic approach enables cancer survivors to explore, adapt, and change. Therapy gives an opportunity for cancer survivors to clarify their thoughts and feelings, and receiving guidance from a psychologist helps enhance coping abilities. This is reflected in the theories behind the intervention that demonstrate both how and why a training for generalist mental health care providers will work. First, we recognize and acknowledge through social constructionism that cancer survivors construct their own meaning of their experiences with cancer and their identity or sense of self as a cancer survivor through interactions with others. This process is explained through narrative theory, which sees therapy as a crucial time for cancer survivors to process and work to change narratives around cancer, such as themes of loss, helplessness, or hopelessness. Together, therapists and survivors can co construct new meanings for suffering, despair, loss, and hope. This is important as, to quote the American Cancer Society, the most common associations with cancer in today's society include fears of dying, mutilation or disfigurement, loss and harm to loved ones through abandonment or burden. The truth is, when someone is diagnosed with cancer, it can be hard to see the forest from the trees, to quote my mother. It's frightening and overwhelming, leaving people feeling vulnerable and exposed. In order to have that therapeutic conversation to help cancer survivors create a new narrative, whether that is a legacy, if they are looking at end of life, or redefining purpose, providers have to challenge biases and stigma that they may have and confront what they know, what they do not know, and what they fear most about cancer. The truth is, it should not be up to cancer survivors to educate their therapists, but for providers to seek out that education for themselves. That is what this experiential learning workshop is for, so that providers can deeply reflect on new knowledge and incorporate newfound concepts into a more personalized practice. To fully understand the spectrum of experiences cancer survivors face, I encourage you to pause this video and read about each phase of cancer more thoroughly. If you take nothing else away from this presentation, I hope you reflect on the unique experiences of cancer survivors and witness just how devastating and distressing cancer can be, and how much a diagnosis of cancer can derail life's plans. As a concerned family member told me, there is no handbook on how to live with cancer. While the training manual I am contriving will not be able to be that or encompass all the aspects of cancer, I do hope with this broad interactive introduction, providers will cultivate an approach with humility and respect. We will know the training workshops are successful if the following outcome is achieved. Providers are knowledgeable in working with the specialized needs, unique experiences, and trauma related to cancer. We will know we have reached this goal when providers report newfound comfort in therapy with cancer survivors, and they have taken on more cancer survivors as clients. The second outcome we will be anticipating is that cancer survivors can identify and specify their choices for mental health care providers. We will know this goal has been reached when cancer survivors start utilizing an expanded list of providers and they are easily able to find and connect with a local provider. This concludes my capstone presentation. As a final word, I would like to thank all of my teachers in the field of oncology, whether it be my supervisors, other social workers, nurses, doctors, professionals, friends, family, and of course, an extra special thank you to my mother, who is the inspiration behind all this and to whom this project is dedicated to. Thank you.